Good morning, everybody. Today we will be discussing about aphra OSCE stations. So first one, I am going to talk to you about the hand hygiene procedure, how they are going to do the hand hygiene. So in case of hand hygiene procedure, what you are going to do is you have to approach the station. Sometimes this will be an isolated station itself, a hand hygiene procedure itself, or sometimes it's given along with the other stations. So for example, if it is given an isolated station, how you are going to perform, that's what I am going to talk to you. So you are starting in front of the patient and there is a hand gel will be provided for you. There is the hand gel itself will be having the standard hand gel, the typical hand gel you will get. So you have to talk to the patient examiner. I am going to demonstrate a hand hygiene procedure. So examiner will give you consent and talk to the examiner. I am adhering with the infection control policies and making sure that I am bare below elbow. So always you have to make sure that the attire should be cut over here. There should not be any attire on the lower elbow, below the elbow. That's very, very important. So if that is happening, that is a violation of infection control policies. That's going to Australia. So talk to the patient. I am bare below elbow, and I have no. Then you have to inform your hands. So you have to show your hands like this way, and then I have no wristwatch. Prompt as I have no wristwatch, and I have no rings in my hand. And ideally, what I would say is with my UK and Irish experience, what's going to happen is the rings, wedding ring is allowed, but if it should be clean or it should be neat wedding ring, it should be smooth. What they describe it as a smooth wedding ring. But in case of some countries, there can be some impregnation, some letters will be there, some names, some numbers, digits and stuff like that. That's the rough edges are there, in which there is a chance of organisms to harbor inside. So my perception is you take off this wedding ring. Even it is a wedding ring, it's having some sentimental value on you, but still take it off for 1 hour or 2 hours, so that will not make any difference. Okay, so take out the wedding ring and show the examiner I have no rings in my hand, and I have no nail varnish. Instead of using nail polish, I talk to nail varnish, and there is no false nail and nails are cut short. I'm adhering to infection control policies of WHO, and I'm going to demonstrate hand hygiene procedure. And if you have a sleeve that is running down, so you have to roll up the sleeve in advance. Okay, so you have to apply the hand gel with the 2 scoops. Then the first thing you have to demonstrate is palm to palm. So this is the way you have to demonstrate palm to palm, in which you yourself is rubbing the gels over there. Then right palm over the left dorsum like this way. Okay, and left palm over the right dorsum like this way, with both fingers interlaced, and then palm to palm with the fingers interlaced. So you go with this way. This is the palm to palm with the fingers interlaced. And the next one, what you are going to do is fingers interlocked on either side. So this is the way you are going to demonstrate fingers interlocked. So you have to rub on the back side. Always you have to make sure that the knuckles, these are the knuckles, so you have to keep an eye on knuckles on both sides, okay, or either side. Then what you have to do is you have to do the fingertip like this way. This is the way you are going to demonstrate fingertip, and this is the way you are going to demonstrate the fingertip on the other side. And then next one is a thumb. Always make sure the thumb is up. So this is the thumb, and this is the thumb, the second thumb, or the opposite side. And then this is the wrist over there, and this is the wrist over there. Always make sure that there is no wristwatch over there, because my wristwatch is here. So wrist on both sides. I'm waiting for 30 seconds to dry. So you can approach the patient if you are going to approach the patient as if it is in a real scenario. But you have to say, but in Australian terminology, they sometimes say it as I'm waiting for air drying. That's okay as well. So these are the steps you have to perform as far as Australian OSCE is concerned. If you are going to demonstrate a hand hygiene procedure, sometimes it can be an isolated procedure. Sometimes this is a procedure that is done along with the other thing. Okay, so my point is when you are going to rub, don't rub too fast, and at least you have to rub 3 to 4 times each time. So for example, rub from palm to palm at least 4 times. You make a number you have to count yourself in your mind. 1 2 3 4, that's enough. Then go with this way, Okay, so this is the way you are going to perform a hand hygiene procedure. Once a hand hygiene procedure is done, then you can say I have done that. Yeah, that's it. I hope you understand the process of hand hygiene procedure. If you have some questions, just come back to me, and I'll be continuing with the series of discussions in the coming videos. Please, if you are looking for any training, myself is Bimal. I am one of the lead trainers in MWT Global Academy. I am training UK OSCE, Ireland aptitude, and Australian OSCE with 100% results. I'm supporting their language, I'm supporting their verbal, non-verbal cues and communication strategies, and also the skills as well. So you will be getting a wonderful experience. If you are looking for any face-to-face training, come back to me, or online training, come back to me, but I prefer face-to-face will give you an added advantage. Thank you very much for listening with this video. Thank you. See you next time.